if you think about the role of health and safety, it is not to actually engineer the solutions. They are to risk assess and they are to monitor, right? They work with professionals like engineers to put up guardings or, design work environments so that they're safer, or they work with hygienists to, improve the physical working conditions for employees. In much the same way, we don't expect health and safety professionals are supposed to design work or to address things like change consultation or leadership behaviours. That is definitely the role of HR, OD, org psychs. But in much the same way as they work with engineers, they can work with these professionals in order to, once they've identified the hazard, to allow them to mitigate it, right? And then to continue to monitor. So the way I look at it is, if you think about your public health model where you got primary, secondary, tertiary prevention, primary prevention is work design. That's where HR, OD come in. They should be recruiting people properly, getting the right people in for the right role, and they should be designing work so that there is autonomy, there are positive relationships in there. People do get a sense of meaning and accomplishment and a chance to leverage their strengths. However, at the secondary prevention level, once we're starting to identify that there's signs of stress or psychosocial hazards in the work environment that are causing people to become ill, then that's where job redesign might come in, right? So we do work design first, job redesign at that secondary level, once health and safety or HR or a combination of the two have identified a risk. But then it goes back to HR, OD to actually identify how do we actually fix this thing. So, definitely. And Wade Needham spoke to the need for HR and health and safety to work more closely together in psychological health and safety on episode 2. And definitely that is the same way as health and safety already work with engineering in order to engineer work environments.